G.K. Butterfield joins us from Washington. He's a Democrat representing the 1st District, which includes parts of the Triangle and northeastern North Carolina. Congressman, good to see you, sir. Thank you for some time tonight.
Thank you for having me.
Absolutely. Obviously, you're on the other side of this. This is kind of a Republican-on-Republican battle for the most part. But are Democrats partaking in efforts with Republicans to try to make sure this does not get passed?
Well, you know, in 2008, when President Obama was running for president, his signature promise to the American people was that he was going to make health care affordable and accessible to every American, and we delivered on that promise. We passed the Affordable Care Act. It's not a perfect bill, but it has provided millions of people with health insurance that they otherwise would not have. And so for the last 7 years, Republicans have tried everything within their power to repeal the Affordable Care Act. They have not had a suitable replacement. They've simply tried to repeal it because they have messaged the benefit of the law to the American people. But the Affordable Care Act is a wonderful piece of legislation. It allows more than 30,000 people in the 1st Congressional District to get tax credits so that they can sign up for the insurance, and the government will help with an offset with the insurance premiums each month. But now the Republicans want to take away the ability of people in North Carolina to get health insurance and take away the tax credit and simply give them a $2,000 tax credit at the end of the year. But the current plan that we have now provides subsidies so that each month people who get insurance through the marketplace can receive a subsidy. And those subsidies are going to be eliminated, not to mention the fact that Republicans want to end the Medicaid program as we know it. For years, they've tried to dismantle Medicaid, but now this year they have a new idea in mind, and that is to block grant the Medicaid program and just give a sum of money to each one of the states and tell the states that they're on their own in administering the program. And we know what's going to happen. I suspect that the Medicaid funding for North Carolina would be decreased by some 40%. That means that North Carolina will be in a dilemma. The governor and the legislature will have to come up with ways and means of providing health care for poor people. The first thing they will do would be to cut eligibility and decide who can and cannot receive Medicaid. And a lot of people currently receiving Medicaid will be kicked off of the Medicaid rolls. They're going to cut the services that are provided. You can qualify for one type of treatment, but not for another. And the third method would be to simply cut back on the amount of money paid to providers, hospitals and doctors and specialists. And so the Medicaid program is in jeopardy. And so we're pushing back. We're fighting back. Republicans are going to have this vote on Thursday. We will not offer any amendments. Democrats will simply solidarity against any changes to the Affordable Care Act. If the Republicans are really serious about fixing the law, then they need to work with us and we need to work with them. But for 7 years, they have refused to negotiate with us on any changes to the law. And so now it comes down to a vote on Thursday night. If it passes the House, then it goes over to the Senate, and the American people really need to be heard, and they need to speak out and need to speak loudly so that our senators from North Carolina will not vote to repeal health care coverage for millions of Americans.
Congressman